Welcome to today's special edition webinar addressing the mental health effects of COVID-19, brought to you by RANE in partnership with the Child Mind Institute. The stress and uncertainty surrounding the global COVID-19 pandemic presents daily challenges to the mental health and well-being of our families and our children. The anxiety around the daily news cycle and the stress of working and schooling from home has led some experts to believe that we are in a dual crisis of physical and mental health. In the aftermath of disaster, there's often an uptick in the number of people with mental and behavioral disorders, and the same is likely to emerge in the wake of this pandemic. In this special edition webinar, RANE founder David Lawrence interviews Harold Koplewicz, the founding president and medical director of the Child Mind Institute. Dr. Koplewicz is one of the nation's leading child and adolescent psychiatrists. He is known as an innovator in the field, a strong advocate for child mental health, and a master clinician. He has been repeatedly recognized in America's Top Doctors, Best Doctors in America, and New York Magazine's Best Doctors in New York, and was named one of WebMD's 2014 Health Heroes for its advocacy on behalf of children with psychiatric and learning disorders. He has been the editor-in-chief of the Journal of Child and Adolescent Psychopharmacology since 1997. Dr. Koplewicz will provide his perspectives on identifying the signs of mental stress and outlining steps companies and parents can take to mitigate anxiety, manage relationships, and better cope during the coronavirus crisis. Our moderator today is David Lawrence, founder and chief collaborative officer at RANE. Prior to RANE, David was an associate general counsel and managing director at Goldman Sachs, and he formerly held various executive positions at the U.S. Attorney's Office for the Southern District of New York. Special thanks to our resident executive director of medical and psychological risk, Dr. Michael Lesser, who helped put this webinar together today. Dr. Lesser is a recognized leader in the public and hospital-based healthcare and crisis management space. In his recent positions as medical director for New York City and state, he was instrumental in developing and implementing nationally recognized emergency and crisis response programs, including the training of law enforcement and first responder agencies. In terms of logistics, our call today will last about 15 minutes or so. We'll leave some time for questions at the end. You can submit a question using the submit a question feature on your screen. This webinar is audio only, so there will be no accompanying slides. And with that, I'll turn it over to our moderator, David Lawrence. David?
Greg, thanks. Mike, thank you for helping to organize this. And Harold, it's always a very distinct privilege and honor, and particularly at this point in time. And, thank you. Obviously, we've worked together in the past around this important space, addressing a wide range of family issues at academic institutions. And obviously, we're at a particularly important inflection point in terms of everyone who is exposed to and who is feeling the effects of the pandemic. Let me begin with a question here, because there's been a tremendous amount of focus, obviously, on the biological or the medical impact of COVID-19. And as one of our colleagues and members of our network, Dr. Craig Katz, who helps lead the psychiatric effort at Mount Sinai, has noted, and he is someone who has studied, pandemics for 20 plus years, that all pandemics actually have two legs. There is the biological and then the behavioral. And maybe we could get just sort of an overarching view of what you have seen in terms of the mental health consequences of COVID-19, and particularly as it pertains to families and children who are living through this.
I think this is, first of all, David, thank you for inviting me and for creating this discussion. This is a unique situation. After 9/11, we knew that the very circumscribed area around Ground Zero, certainly the families that lost someone, families that knew someone, were most affected psychologically by the events of 9/11. And we also learned that people who were troubled and anxious and had disturbing events in their life, like a divorce or a violent domestic situation, they were more at risk on September 12th. This pandemic is so unusual in that everyone in the United States will have it has an effect on their mental health. That doesn't mean everyone has a mental health disorder, but everyone's mental health is affected. So the way to think about it is they're kind of like four categories. There's one category of 60% of the population typically developing happy-go-lucky, enjoying life, bouncing along with the good and the bad. And this group, if you think about them from kids' point of view, have lost the structure of their lives. There's no more school. They're worried because their parents have financial concerns. They're worried that their grandmother might get ill. There's a real concern that something unusual has happened. So they're living under greater stress. The next group is about 15% of the population, and these are people who have symptoms, but they're subclinical. In other words, they may be a little more quirky, they might be a little more moody, they might be a little more inattentive or odd, but their symptoms don't cause them distress and dysfunction. They just go along in life, and this kind of stressor pushes them over the edge. And then the people who are most vulnerable, we have 20% of the population that has a mental health disorder, whether it's an anxiety disorder, obsessive compulsive disorder, depression, ADD. It doesn't really make a difference. On a good day, only 40% of them get helped. So the 60% who are symptomatic and who have distress and dysfunction are particularly troubled by this kind of long-term problem because it's not a week, it's not an event that occurred on September 11th and then we recovered. It's an ongoing, rolling difficulty. And even the last 5% of the population who have very serious and very severe mental illness, people who have schizophrenia or people who are low functioning with autism, they usually are not affected because they either are not emotionally or cognitively in touch like the rest of the population. These individuals are affected too because now the supply chain has been affected. So their pharmacies might not have their medications. Their day treatment programs have been disrupted. Their social gatherings where maybe they would go to a gym or go for a jog. All of those things, because of this pandemic, are stressing every single category. So with that, we have to recognize that even in the best families, meaning that they're healthy and they have shelter and they have funds, that they are feeling stressed because all of a sudden they're working on screens, their kids are at home having to study and learn on a long distance learning, and there is more tension in the house. So that everyone has to be aware that there are mental health symptoms that are coming up, and for some of us, they will be very, very severe. The ones who struggle on a daily basis before this event are more at risk for more symptoms and really for hopelessness and maybe even some suicidal ideation and suicide attempts.
Harold, the nature of this pandemic, and nobody was prepared for 9/11. Arguably, nobody was prepared for the financial crisis. And now, as you look at this pandemic, what is it about that, about the current moment in time that makes this so unique and potentially impactful for mental health issues?
So I would tell you that uncertainty is bad for the stock market, and it's bad for human beings. You know, we like to know what's coming. We can prepare for bad things. If someone says to you, you know, something bad's coming, you better save some money, or you better get your windows covered because there's a hurricane coming, we can deal with that. The uncertainty of this is very troubling. And unfortunately, there's mixed messages. So scientists say one thing, the president says something else, a governor says something else, a mayor in Florida says something else that the governor says. All of that uncertainty, not only that mixed message, so should I go out, shouldn't I go out, do I need to wear a mask, don't I have to wear a mask, is really very troubling for everyone, particularly for kids, because they like to be told what's ahead and they like to be reassured that somebody else is in charge. So that makes it worse. And also the uncertainty of this virus. So it would be nice to tell everyone that in a month, 3 months, a year, we'll have a vaccine. No one could definitively tell you that. I think they can tell you that, you know, September, October might be worse because we'll have the flu season along with COVID. That means you better take the flu vaccine this year if you've skipped it in the past. It's really important to keep washing your hands, and it's important not to shake hands with anyone and keep some social distancing. And I could tell you that if we take a consistent message, we will get used to this. I was around for 9/11. If you would have told me that I had to get to the airport at least an hour or 2 hours ahead of time, that I had to take my belt off and my shoes, and that I had to go through a metal detector, and that I couldn't keep my toothpaste, and I would have said, "Don't be ridiculous." I get to the airport 20 minutes beforehand. I run through the airport and I bang on the door, "Let me in to the airplane." And that changed, and we got used to it. And I think that Americans, and in fact humans everywhere, will get used to it if there's a consistent message saying, for the time being, and for the for the next 6 months or until we have a vaccine, we are going to wear masks, or we're going to have to wear gloves, or we're going to have to keep washing our hands, and restaurants can only be a quarter full or a half full. We will adapt, and in fact, the sooner they tell us the message, the better we'll be, because we can get used to that. And that has to be, now that's a difference between talking to an adult and talking to a child. So if you have a child at home, telling them that there's no school for the rest of the year, that might be too overwhelming. And so if there's not a definitive message, then it's much better to say, let's take this week by week. This week we're going to be home. This week we're doing distance learning. This week we're going to manage school right here. And how are we going to do that? And parents then have to take on a bigger responsibility, especially it's very hard when you're juggling a full-time job also, but to create structure. We have to get up at a certain time. We have to brush our teeth. We have to get ready for school, even though school is just at your desk. And we have to have a structure to the day, because we're going to take a break and we're going to eat lunch together for 30 minutes. And in the afternoon or in the early evening, we're all going to take a walk. Or Wednesdays we're going to play board games, and we're really going to keep to that schedule, because otherwise a lack of schedule and a lack of any kind of structure will make everyone more anxious. And anxiety, by the way, which is a normal phenomena, when it becomes pathological, when it becomes so severe that it affects your functioning, is the most common disorder we have. And left untreated, it really usually morphs into depression. And these are serious illnesses. It's not that I'm depressed because of COVID. I'm depressed and I don't want to eat. I can't sleep. I can't concentrate. There's a real difference between the feeling of being depressed or demoralized versus the entity or the medical condition called depression. And the same goes for an anxiety disorder versus just feeling anxious.
So very helpful insights. And I actually want to unpack that and tie it into something else. And look, with 9/11, we had, obviously, in a single day, there were 3 separate events, but it wasn't, and then it stopped. And although our lives changed, and there were all sorts of measures that were put in place from a security standpoint, here people are bombarded, and I like the term uncertainty. They know it's going to end at some point, but they don't know when, and they don't know how. And the inability not only for adults to come to that realization, but how to communicate with their kids and how to live with that kind of ambiguity makes it very, very different than 9/11. And had we suffered a series of subsequent attacks on a regular basis, and the situation would have changed very, very quickly. And so, in an environment, Harold, where adults are unsure about everything that's occurring and where it's going and the consequences, et cetera, how is it that they can in turn convey to their children what is needed around certainty, predictability, the routine nature of life, and that that this too will pass? And how do they do it without misleading? And how do they do it in an environment where even young kids are getting information from all sorts of different places, which is very, very different than how it used to be?
Yeah, this is one of those conversations that has to be had. You have to talk to your children about coronavirus, whether they're 4 years old or whether they're 24 years old. And the reason for that is they're going to hear about it elsewhere. And kids are very aware when you're not talking about something important that's in the air, or that they get the feeling that you're hiding something. And I think it's perfectly okay for parents to, first of all, to use language that their kids can understand, to make sure that their children know that they can ask questions, and if they don't have questions now, the conversation isn't a one-time event. It's an ongoing discussion, and therefore they can come up with questions again. And don't be surprised if it's the same question again and again. And for young kids, they're very egocentric, and they want to be reassured that they're going to be okay, and that their parents are going to be okay, and their grandparents are going to be okay. And being able to tell your children what kind of things you're doing to keep them safe, whether it's washing their hands, social distancing, wearing a mask, staying in the house, being very careful about the way you interact with other people. The reason we wear a mask is not only to protect ourselves, but to protect our friends and our neighbors and our relatives, because we don't want to get them sick. And when you talk to a teenager or a college-age student, you have to recognize that their loss is greater than our loss. In other words, they're never getting back junior prom. They're never going to get back their graduation. They're never going to get back all that wonderful kissing and hugging and, hooking up that you do when you're in high school and in college. They'll get it back later, but these events are sometimes one-time events, like graduation, like proms, like rushing a fraternity. And for many of them, they've lost that, and recognizing and acknowledging that loss is really important, and saying, this is really, I can understand how bad you feel. While simultaneously we're lucky, we have a house, we have food, but that doesn't minimize the loss that you're taking, that your college experience or your high school experience is very different than what we had wished for you. And I think it's also important at times to be able to acknowledge that we are anxious, that we're uncomfortable, that the uncertainty of this makes us upset. And the important part is that you model how you work. How do you work that out? We have a campaign that we started on May 1st called #WeThriveInside. And we asked famous influencers and celebrities to tell us how they're maintaining their mental health while quarantined or while, during COVID-19, and how they could help their kids if they have kids. And then we direct them to childmind.org, where we have parent resources. But it's interesting because most people will admit who have joined us, Emma Stone and Margot Robbie, and today Kevin Love, will talk about how uptight they are, how upset they are, how on a good day they're pretty anxious, but yet they still model and say, well, it helps me if I do physical exercise. It helps me if I don't watch cable news. It helps me if I touch base with my mom or dad once a day, grandma and grandpa. It's really important that I go to sleep at a normal hour so that I can wake up early in the morning and start the day fresh. It really helps if I journal. And being able to share with your kids things that you're doing to maintain your mental health is really important, so that if you get irritable later on and you snap at them, you can apologize and say, you know what, it got to me. No excuses. I'm sorry. I guess I need to do more exercise, or I guess I have to do some more mindfulness or meditation. And I think it's a great time, considering we're stuck in the house, and for many of us, we're having more meals with our adult children or even our teenage kids than we usually do. 3 meals a day, some of us, instead of the one meal that we would have once a day, or for some of us even less frequently than that. I think it's very important that we're honest with them and we model for them how we manage our anxiety. That's really, parents usually have a ton of things to do. We just gave them more responsibility. We gave them more responsibility of structuring their kids' day if they have school now and distance learning. And we gave them more responsibility to have discussions with them about hard topics in a calm and reassuring manner.
Well, I'd also add more responsibilities, but without necessarily the insights or tools to manage those increased responsibilities.
Yeah. So I think
that's
that
why your efforts are
volumes,
so great.
by the way. Yeah. Well, it also speaks to the response. Sometime in the middle of March, we started doing Facebook Lives. So we have a Child Mind Institute Facebook page, and we have information there. But it became very clear that besides a robust set of guidelines and information for parents, parents needed a place where they could ask questions. And I think in the first week, we found that we're doing it twice a day in the beginning at I think 11 and at 4, and now we're only doing it once a day because of we're sharing these videos in the morning. We would get someone would watch, and maybe 8,000, 9,000 people would watch the Facebook Live, and by the end of the day or 3 days later, there'd be 237 views of this 30-minute conversation about managing
By the way,
a child
Harold,
with
I'm going to interrupt.
ADHD.
237,000 views.
237,000. So right now, so almost archivally it got more. Do you know what I mean? And so it wasn't live; it was Facebook Live that I'm watching, an old Facebook Live. And what's interesting is that we find that the same questions. So you do a presentation for 5 or 10 minutes, and then you open up for questions. And a lot of the same questions keep getting asked again. How do I get my kids to sleep? How do I describe this to my 10-year-old? How do I deal with the fact that my 20-year-old wants to get out of the house? I mean, again and again, the same questions, but needing the reassurance of hearing it again from a trusted source. And what I found fascinating is that we became innovators. We said, one of the audiences that we do not serve properly is the Spanish-speaking families. So we created a Childmind Institute Facebook page in Espanol, and twice a week we have a Facebook Live by a Spanish-speaking child psychiatrist. And we went out and we found a whole bunch of celebrities and influencers who speak Spanish fluently, and had them do 1 minute or 30-second videos so we could get this audience to recognize that we're a resource for them also. And the more we thought about how needy parents are at this moment, how alone they feel in their ability to deal with the parenting during COVID-19, we started to think about all of the first responders. And, if you think about the epicenter of COVID in New York, it's really Queens. And when you start seeing those images of Elmhurst Hospital or of Bellevue or Jacoby, and how it almost feels like a war zone, that every day any employee who belongs to the New York City Health and Hospitals Corporation is, they're putting their life on the line to save other people. And yet they still have families, and many of them don't even want to go home to their families because they're afraid of giving them COVID-19, or they're separated from their families within the house. And so we established a partnership with New York City Health and Hospitals Corporation, saying we will give 1,000 phone calls, 30-minute phone calls to any employee of New York City Health and Hospitals who has a concern about their kids. So they get a 30-minute consultation with privacy, and whether they need reassurance about something simple or it turns out to be something more serious, we are there for these heroes. And we got a donor to support this for 3 months, and now we'd like to raise funds to carry this on for even longer, because as we started this conversation, the anxiety and the mental health symptoms are going to continue once COVID is more under control. But we also would like to do it for first responders who are EMTs, or who are policemen, or who are working in Los Angeles public hospitals, or who are working in Houston or in Miami. Because unfortunately, what makes this so horrific is that it's global, and what makes it really, I think, extraordinary for us Americans is that we seem to be the epicenter as a country. And that seems to be really remarkable, because we never think of ourselves as being, victims, but we are getting hit harder than anybody else. And I can tell you that the other place that we found a need is when we start talking to big companies, that there are companies that want to help their employees, basically giving fireside chats or webinars so that their employees have some place to talk about and learn about the balance between having your kids at home being educated and simultaneously working full time. And also for a group of employees who are very young, who have never been hit by this kind of adversity or this type of uncertainty. And how do we help them become more resilient during this time period? Don't fold up the tent. This is a time to lean in. This is a time to remain more focused. And we need you more now than ever. These companies rely on you. You are the backbone of this corporation or that organization. And it's amazing to me how many corporations and publicly held companies as well who recognize that their employees' mental health prevention almost, or their mental health augmentation has become part of their priorities.
So Harold, there's an expression that was shared with me many years ago, that you're only as happy as your least happy child. And one could extend that, that someone is only as productive at work as their least happy child. And I'm going to I want to take a minute to sort of praise you, because you're not new to this issue. You've been doing this for your entire career. And a very significant part here is helping people know where they can go and where they can turn to get answers to their questions, or even to know what questions to ask, and where are the trusted platforms, the trusted sources. And it is either coincidental or possibly ironic or possibly preordained that, May is National Mental Health Awareness Month. May 5th is Giving Tuesday today. And obviously, this wonderful hashtag We Thrive Inside campaign, and what you're doing for frontline medical professionals to sort of help people to at least have a place to go where they can start to ask the questions, know the questions, understand the answers. And a good part of your efforts throughout your career around mental health, which is now getting increasing attention, and you have celebrities who are coming forward to share their experiences, is this notion of removing stigma, shame, sense of embarrassment, inadequacy, removing this notion that it must just be me, isolation, etc. And maybe you can talk about that as, part and parcel of what you have been accomplishing throughout your career, and certainly part and parcel of the programs that you're initiating now, literally in the midst of this crisis, and trying to scale and extend what I'll refer to as your knowledge, your expertise, and the information to help a broad range of people.
So I think there's always a silver lining, and it sounds a little Pollyanna, but the silver lining, I think, of COVID-19 is that instead of 1 out of 5, which is still an extraordinary number, the 20% of Americans have a mental health disorder, and 17 million kids before the age of 18 will have a mental health disorder. And just to give you some perspective, 15,000 have cancer, and 200,000 have diabetes, and 7 million have asthma, and 7 million have peanut allergy, but 17 million have a mental health disorder. And it goes up to 20 million if you add learning disorders and learning disabilities. So these are the most common illnesses of childhood and adolescence, and the overwhelming majority of kids don't get identified and don't get treated. They are symptomatic, they struggle in school, they're more likely to have academic difficulty, they're more likely to drop out, they're more likely to have an interaction with the juvenile justice system, they're more likely to hurt themselves. And the problem has been getting worse before COVID. 14 to 24-year-olds, the second leading cause of death is suicide. Worldwide, for girls 15 to 19, the leading cause of death is suicide. Now think about that. Worldwide, it's not starvation, it's not homicide, it's suicide. So what's really troubling is that up until 4 years ago, 5,000 young people died of suicide between 14 and 24. And in the last 4 years, that number has jumped to 6,120. And we used to have 600,000 young people show up in emergency rooms every year for a suicidal attempt or for severe suicidal ideation. And in the last 4 years, it jumped to 1.2 million. So that means every 30 seconds in America, there's somebody showing up in an emergency room because of suicidal behavior or suicidal thoughts and ideation. So that's so on a good day, the mental health system for children and teenagers in this country is inadequate. During a bad time like a pandemic, it becomes overburdened and breaks. So that it's not 1 out of 5, it's 5 out of 5 people feeling mental health symptoms. That doesn't mean they all have a mental health disorder, but they all are more stressed, they're more anxious, they're more worried than they were before. And I think that the silver lining for that is that it's destigmatizing. When you have a few days of feeling incredibly tense and worried, and then it goes away, you have some compassion for what it must be like if you have those kinds of feelings for weeks on end when there's nothing real to worry about. In other words, you're convinced you're going to be contaminated by some germs that aren't really there. And now your neighbor can understand what that must be like when you're fearful to walk outside the house. And the other silver lining for us seems to be the fact that we've been able to eliminate all the borders between states with licensing agreements. And it makes perfect sense that every state should have a bar exam for lawyers because there's different state laws. It doesn't really make sense that we have licensing agreements that you can't practice psychology or social work or psychiatry or medicine between Louisiana and Alabama, or between New Jersey and New York, or between California and Arizona, because each state has their own licensing. And during this COVID pandemic, they've eliminated that. So the Child Mind Institute has gone borderless. So we are literally taking care of kids who've just been discharged from Meningers, which is in Texas, or from McLean's, which is in Massachusetts, or from Rogers Memorial, which is in Milwaukee, Wisconsin. And so we're able to take care of kids and take away borders and take away barriers. The other thing that I find fascinating is that we have specialized treatments, for instance, for kids who have social anxiety, kids who are pathologically self-conscious. We have a group going on right now with 6 kids from the New York metropolitan area, 1 kid from Arizona, and 1 kid from Arkansas, which really speaks to the wonders of telehealth that this COVID has necessitated. But in the same time, I think it'll get better and it will improve 2 things. We will be able to reach more kids, I hope, after COVID gets contained. And I'm also hopeful that everyone will have more compassion and more understanding for the kids and teenagers who struggle with one of these disorders. I mean, it could be, it could be your child. If it's not your child, it could be your niece or nephew statistically, or it could be your best friend's son or daughter. So that's the only, I'm trying to, believe me, running an independent nonprofit for children's mental health in the best of times is very challenging. And during a pandemic, it has become beyond difficult. But that said, there are positives here that we should look at and take an opportunity to fine-tune telehealth, start to realize that we have barriers that don't need to be there, and we certainly have the ability to be more understanding and more compassionate to people who are struggling with a mental health disorder. I've been around a while. I find it fascinating how America innovates in great ways. When I was a kid and they would take you to religious school, on Sundays they would throw you in the back of a station wagon with 6 other kids. There were no seat belts. You would just bounce around. Today, you don't get into a taxi without putting on a seatbelt. Smoking, everyone smoked. There were cigarettes in every, in my parents' house and my in-laws' house and everyone's house. It was just gracious. You would offer someone there was a box with cigarettes. People don't do that. When AIDS came out, we were petrified. People didn't know what was going on. And it took such a long time for people to realize that this wasn't a gay disease. It wasn't GRID. It was a virus. And we found medicines that, really prevent the death of people with AIDS. And so I'm quite convinced that this is a moment where we can do that now for mental health disorders, where we could be more passionate and more compassionate to 1 out of 5 of our citizens who are struggling and don't have adequate insurance coverage, don't have adequate access, and certainly have too much shame for having one of these disorders.
It's a great message, and obviously I know how hard you're working to share and scale knowledge and insights from the Child Mind Institute.
I think, Dave.
Yeah.
David, I think there's something really interesting that's happened. 20 years ago, I remember when I started the NYU Child Study Center, I would sit at these fancy dinner parties, and inevitably the women to my left and right would start talking to me about some friend's child, some distant relative's child. And today, people meet me and immediately will say, "Oh, by the way, my child has depression, or my child has OCD, and he's being treated here or there, and what do you think?" So, it's not screaming from the rooftop, but certainly much better than 20 years ago. But I think there's a generational shift. The fact that Emma Stone is on the board of the Childmind Institute and is incredibly open about the fact that she struggles with an anxiety disorder, and that when she was 7 years old, her parents took her for treatment, and that how much treatment has helped her, and is willing to talk about what makes her life easier, and the fact that she's willing to ask her friends to help in this endeavor, I think speaks volumes. But we did that 70 years ago with Danny Thomas and St. Jude's. They have not only had laser focus on treating childhood cancer, but they have us embracing children with cancer. We're not afraid of them. We don't whisper the word. And our hope would be that if you know someone who's struggling with one of these disorders, you don't look away. You ask them how they're feeling. You tell them that you're glad to see them again, that that they came out of the hospital, or that they look so much better, that they're smiling, and being engaged with them, not turning your head. And we've done it before, and I'm convinced America can do it again.
Optimistic message. Harold, let me, I have two pragmatic questions for you. Number one, very often the issues of mental health, mental illness, it's sort of the proverbial iceberg. Some portion is visible above the surface, some you might be able to glimpse underwater, but a good portion is beneath. Give parents a sense, and we'll be circulating a very, very helpful checklist, which Harold has prepared, as part of this presentation. But can you give parents a sense of what they should be looking for, understanding that, kids may not come forward and explain exactly how they're feeling, but behaviorally, what should parents be looking for, and how, the special words that might be helpful to convey not once but repeatedly?
Yeah, so I think that there should be some broad strokes, right? I think parents should look at symptoms like anxiety, behavior like tantrums and meltdowns, signs of depression, and even suicidal thoughts and behavior. So what do I mean by anxiety? If you have your child, their appetite, their concentration level, how they sleep, what gives them enjoyment. If all of a sudden you have a child that's repeatedly asking for reassurance when this is a much more happy-go-lucky child, that's a red flag. When there's a reluctance for them to separate from you, when you say, I'm going out for a walk, and they're perfectly safe at home, or they're following you around the apartment or the house, and that even if you go into the bathroom, they want to stand outside the door, that again is a sign that's different than or going to sleep at night, that all of a sudden they're a night visitor. You should worry. And you should also be concerned if there are more physical complaints, if they start saying they're having headaches and stomach aches. So those are some of the things that anxiety has. And surprisingly, anxiety can also have irritability and temper tantrums. You could all of a sudden see a kid having a short fuse when that never happened before, where it seems inexplicable that why are they getting so upset? All of those are signs that your child is more worried than they normally are. Tantrums and meltdowns are also something that we certainly see with kids with ADHD and oppositional defiant behavior, but their baseline. If this is much more of an easygoing child and all of a sudden everything is bothering them that shouldn't bother them, that they are sitting at the wrong seat at the kitchen table or the dining room table, or you tell them they have to wait a few minutes before you can read a book to them or get to their question. Again, a change like that is something to be concerned about, as well as moodiness. That we all should have. There are times when we're upset, we're demoralized, but if you see that your child all of a sudden has this pessimistic outlook and you can't reassure them, and that they're acting like it's really the plague out there, that everyone's going to die, and that they can't seem to see the light at the end of the tunnel, that is a change. And for depression, it's also a change in sleep. Kids they go to sleep at 8 o'clock, 10 o'clock, midnight, whatever it is, and if your kid can sleep through the night. If all of a sudden they're waking up in the middle of the night, or they're waking up much earlier than they usually do, another red flag. And the other part is more certainly for teenagers and young adults, is that if they start to talk about how hopeless they are. The number one symptom for people who become suicidal and make suicidal gestures or make suicidal attempts is hopelessness, feeling they can't get out of the box. And surprisingly, most people don't realize that springtime is when this happens more than ever. It's not Christmas. The biggest time of year is springtime, when everything is blooming, where people are feeling so good that they can go outside the house and the weather is grand, and they don't feel like there's rebirth in them. And so being aware that if your child, or particularly teenagers and young adults, are talking about that they can't figure out how they're going to pass classes, how they're going to go back to college, how they're ever going to get a job, lots of them real problems, but with real solutions. You have to be aware of that, because that is the most worrisome part, is that this kind of pandemic can create that sense of hopelessness that there's no solution. And there are plenty of solutions. It's amazing, millions of dollars are being given out to companies with PPP, even with all the bumps in the road. There are new jobs that are going to be created. We will get through this. This is bad, but there has to be a sense of hope. And when people feel helpless and hopeless, that's when they tend to hurt themselves. So we made this tip sheet with some very good recommendations of what you should do if some of these symptoms won't go away. And anyone who's listening can get them by going to childmind.org/coronavirus. But on top of that, RANE has got a copy of it, and we'll be able to send it out to everyone. Because again, I think this is a time where parents have to be better informed than ever before. This is a crisis. We're living in an extraordinary, unprecedented public health crisis, but we have to think about our own mental health and our kids' mental health.
Harold, the other side of the equation, as the nation rolls out a return to work program, one which no doubt will have some bumps in it, and there'll be some openings and closings and maybe reopenings and things like that. But with respect to the importance of these mental health questions, what is the message that employers should be giving to their employees, not only about their own mental health, but the mental health of their loved ones, their family members, etc.? And in parallel fashion, what should employees be messaging, to their supervisors and to their employers about, what's been occurring and what is occurring in their homes? Right. How do you begin to
David,
address that? Because it's not a
that's the important. That's a $64. Yeah. That's a $64,000 question. So, it's not a light switch, right? We're not going to turn on the lights and say everyone back to work. It's going to be more like a dimmer. We're going to do this in phases. But I think we have to reassure our employees, and our employees who have to take mass transit, or our employees who are worried about their kids at home. And the thing that you have to remember is that if anxiety disorders are the most common mental health disorder of all the mental health disorders, part of staying at home for an anxious person is that you avoid social interaction. And if you are socially anxious, you are no longer exposed to the thing that makes you anxious. Or if you worry that something bad will happen to your mom or dad or to your kids when you're separated, you don't have to worry about that because you're at home with them. And if you're one of those people who worries about your performance all the time, well, by being at home, you could just work extra hours and make sure your performance really looks good. So those three types of patients are all going to have a tough time coming back out of the house, because all of a sudden the thing that makes them anxious is they're going to be exposed to. And the way you get rid of these things is exposure response prevention. That's the treatment. You won't die if you touch the floor of the subway and eat candy. And that's a hard one to get past, but you can get people with OCD to do that usually if you do it gradually. And now you've taken away the exposure. So we're going to see a lot of anxious employees, a lot of anxious children, and we're also going to get a lot of PTSD. We're going to get a lot of people who have had terrible trauma. In the 100,000 people they're projecting, Americans are going to die. That means that we're talking about about 1 million people or 2 million people are going to know people who died. So all of them are going to have grief, and some of them are going to have PTSD. So it's going to be tough. So if anything, I think mitigation of these disorders becomes part and parcel of what good employers are going to do. Whether it's going to be mindfulness, and saying, at our office every day, we're going to have a 30-minute mindfulness session. If you'd like to participate, you can do it online, or you could go upstairs to a certain room where you could sit and we'll do mindfulness, guided mindfulness. It doesn't even need someone there. It could be done on a screen. We are going to encourage at schools, for instance, more physical activity. We know that 20 minutes of cardio every day where you sweat a little bit is actually very good for your brain on a good day. It's particularly important on bad days, so that companies that are really concerned about their employees' health, where they encourage them not to smoke and they encourage them to join gyms, are now going to actually be a little more specific. They're going to actually say, we offer you this during the workday, during lunchtime, or at breakfast. We are recommending that everyone who can should go take a walk for 20 minutes. The boss, we've recommended to a few presidents of colleges that they should say that there is a 10 o'clock walk where the president of the university, depending on his physical or her physical shape, will either jog or walk, and the provost gets the evening walk, where you recognize that there are certain things that are going to protect our kids and our employees' mental health, which in turn are going to make them more productive. Because ignoring this is going to increase absenteeism, is going to increase distractibility, a lack of concentration, a lack of focus, more worry. And at the end of the day, they're not going to be, the kids are just not going to be as productive at school, and the employees are not going to be as productive at work.
And a good part of the messaging, Harold, and again, I'm picking up themes that you've emphasized throughout the career, is the ability for, I think, employers to remove any sense of stigma, shame from raising these issues and acknowledging that there are challenges both in the workforce and at home. Yeah.
Well, think about it from, it sounds paternalistic, but the fact is that CEOs and COOs and leaderships of companies are in charge, and they have an obligation to reassure all the employees and to be able to say, this has been tough. I'm so glad to be back at work, but I have to tell you, wearing a mask at work is uncomfortable, but we've decided to buy masks with our logo on them, so we're all in this together. And I hope you'll join me, for a walk at such and such a time, even if you have multiple offices. Even if you're Charles Schwab and it's everywhere. Then what are we going to do to make sure that we're going to keep our workforce mentally healthy and therefore, in turn, physically strong? And I think that unless, that seems another step that leadership is going to have to take that you typically wouldn't do. You would just basically say that's not our business. But I think the best way to think about this is, David, you and I are about the same vintage. When we went to high school, sex education was not sex education. Some gym teacher taught the boys something, and a different, a female gym teacher taught the girls. And I don't think there was ever any, there was maybe mention of an egg or a sperm, but they never told us or talked about how they got together. Once AIDS hit, it's amazing how American parents wanted schools to talk about prevention. What is the condoms and how you do get AIDS and how you can prevent getting AIDS and safe sex. And that discussion became part and parcel of American educational system. And today, I think the works system of America is going to have to start talking about mental health prevention and mental health strength, not mental health illness, but mental health wellness that is going to be necessary after we've all been traumatized by COVID-19 in different ways. But if we want to stay, we can't ignore it. That's the important piece here.
That's great. And Harold, just to take one of your initiatives a step further, by having famous people come out and talk about either their own personal struggles or the struggles at home, that's gone a long way to destigmatizing the challenges around mental health. And I'm curious whether, as part of the messaging to the workforce, to the extent that leadership at companies that have dealt with these issues, and obviously respectful of people's privacy, et cetera, to the extent that people can actually share their own personal challenges and what they've struggled through. Mike Lesser and I were on a call last week with a senior partner at one of the world's leading law firms who shared with us basically his battle with a variety of mental health challenges and how he had to take a leave of absence from the firm. His career was, basically at risk. And he, after taking the leave of absence and getting medical help and all sorts of support and, learning new techniques for dealing with, the challenges, he was not only able to come back, but he was able to come back and openly speak about these things and how he was embraced by many, many people and how he was supported by many people and how many people have in turn come forward to share with him what they have gone through and the, a general cultural shift within their law firm around these issues. And, maybe you could just speak a little bit to that about, the power of the narrative and the power of the messenger. In,
right. So in 2017, we started this. Yeah. In 2017, we started a campaign called #MyYoungerSelf. What would you tell your younger self about your struggle with a mental health or a learning disorder? And Emma Stone, that's where I met Emma Stone. She came out on May 1st and talked about her struggle with anxiety. And Jesse Eisenberg did May 2nd. And May 3rd was then Lieutenant Governor of California, Gavin Newsom, who looks more like a movie star, in my opinion, than some of the movie stars, and said, I've been struggling with dyslexia my whole life. Going through college was hard. People thought I was stupid. People said it was good that I was good looking. I mean, all the myths and misconceptions. And once Gavin did it, well, then Jay Leno was willing to talk about it. And what was really interesting, in 2017, the majority of people who participated in #MyYoungerSelf were people who talked about dyslexia. Learning was easier to talk about than mood and anxiety. But by the next year, by 2018, most of the celebrities and influencers were talking about struggles and bouts with depression. And so I think that the door starts opening up. And I think the difference this year is that every CEO can talk about, statistically, it's impossible that every CEO has dyslexia, depression, or anxiety, but every CEO has had an incredibly demoralizing time during COVID. They've either had to furlough people, or they've had to struggle with balancing budgets, or they've had to deal with home environments where maybe someone got sick or someone died or their parents died. Everyone can be empathic. This is a moment where I think great leaders can show some empathy and genuine empathy for, not sympathy, but empathy for their workers and their employees' plight that they have just gone through. And I think that will work wonders in being able to help support them and get back to a new normal, because it's going to take a while. I mean, I don't know when we're getting a vaccine, but we're going to have to live with COVID, and we will have to go back to work in a safe way. But if you have a CEO who has a better understanding of what's going on and says, what, we're going to institute mindfulness, or we're going to institute more physical exercise, we're going to get a consultant in who's going to work with all the employees on parenting issues while they're working, balance work-family balance right now. Those companies are going to do significantly better, but it has to start with the person at top being able to say, I can empathize. This has been really challenging. The same way we ask parents to admit to their kids that they have worries, that they're concerned, but that the way they're dealing with them is with exercise, or with reading a book, or taking a walk, or avoiding things that upset them, like cable news. Those kinds of messages and that kind of leadership style, I think, is going to work wonders for the same way you talk about a lawyer who changes the whole culture of a law firm. I think it will be a very positive message for many, many employees who will feel proud to be back at work.
We have just a few minutes remaining, and I want to collapse. We've been getting great questions online, and you've been actually answering many of them. But if I could just, what has been said about the current pandemic, and I appreciate your point that there are some silver linings here. One of the observations that's been made is about the acceleration of trends that were already occurring. And perhaps you can just give us, quick commentary about how you think about telemedicine, some of the shared platforms for support groups, the ability to deliver online questionnaires to identify, potential issues, but the role that technology is playing. But I know that even with advances in technology and the ability to scale outreach and for people to text and get answers back, there's still a very, very important role about the human touch and face-to-face interactions. But maybe last couple of minutes, you can give us a bit of an overview and commentary on those points.
Sure. So first of all, we have a shortage. We don't have, if we just deal with children, 17 million kids, right, under the age of 18 have a mental health disorder. There's 8,500 child and adolescent psychiatrists in the country. There are 3,500 child psychologists, people who've done at least 1 year of an internship in child psychology. So the numbers just don't work. So we need to encourage more people who come out of graduate schools and social work schools to actually learn evidence-based treatments, behavioral therapy, cognitive behavioral therapy, parent training, not just supportive therapy, which is pleasant but isn't as effective as some of these evidence-based treatments. That said, the barriers that we have had with distance, where there are parts of the country where there are literally 11 child psychiatrists for 100,000 kids, versus other parts of the country where there are 55 or 100 per 100,000, which is still problematic because that's 20,000 out of 100,000, 20,000 kids have a mental health disorder. At least the barrier of distance has automatically and remarkably been addressed by telehealth. And that said, that's much better than I ever would have expected. I can tell you there's still a barrier of adopting telehealth for new patients. People do want to meet their doctor. They want their doctor to feel that they know them, that there is something even without touch, just by looking and being close to each other and getting a feel of what's going on and the nuance that a camera doesn't always get. But this is better than nothing, right? And we had a lot of nothing for many people in this country. The other place that's been remarkable is crisis text line. So they've never been busier. So they have at least the ability for the crisis for someone to text and maybe get some help. That's not the same as necessarily evidence-based treatment before you're in that crisis moment. But that again is a lifesaver for many people. I think that we'll get better at this. Zoom and Microsoft's Teams and, systems that freeze on us, I think the platforms will get better. We just developed something with Parents Magazine called crisislogger.org, a website where you can record or film your experience as a parent during, or as just an adult, your experience during COVID, and the idea that we could collect data that will help us for the next crisis. The fact that literally tens of thousands of people have already participated. They get a word cloud. There's also an optional questionnaire that's funded by the National Institutes of Mental Health. Is again a way that we never thought of reaching, hopefully millions of people eventually, to get their feedback and in real time their understanding of what they're experiencing. So I think there's a lot of opportunity. All of them with some bumps and some provisos about security and about privacy issues, but in the long run, I would tell you I'd be surprised if we go back to only in-person sessions. I think that telehealth and telepsychiatry is definitely, or telemental health is going to be here. At the Child Mind Institute, we're just trying to figure out how we can fine-tune this so that instead of seeing tens of thousands of kids, is it possible for us to see hundreds of thousands and reach millions of people more than just with information on our website and with our videos, but in some more meaningful way. I also think it's an opportunity to train people. I think telehealth is going to make it easy for us to do teleeducation. So could we make teachers across the United States better prepared for the anxiety symptoms we think and believe and predict that children will be experiencing in September? Could we get them to be better at recognizing what an anxiety symptom is, and could we give them some techniques that they could use as better behavioral management techniques and classroom management techniques that'll make it easier for everyone in the class without having to go see a mental health professional? I think that would be remarkable. So I think there's opportunity there. It's just going to be how innovative states will be and counties and educational systems.
Harold, thanks so much for a very, very informative hour. I look forward to actually continuing the conversation through our podcast to follow. We will be doing a write-up of this conversation, and we have your checklist, and we'll be forwarding a number of links. But clearly the work that the Child Mind Institute has done and is doing has been incredibly helpful in changing not only what I'll refer to as perceptions of mental health, but most importantly what actually can be done. And so I know this is Giving Tuesday and it's Mental Health Awareness Month. For those people who are attending or listening in the rebroadcast, there's an opportunity even on a crowdsourcing basis to support the terrific efforts of the Child Mind Institute. We're obviously at RANE, we're honored to be a partner and look forward to the continuing conversation and most importantly, introducing scalable solutions into the marketplace to reach everyone. Harold, thank you again.
Thank you, David. It's always a pleasure. Really appreciate everything you're doing.
That concludes today's webinar. I'd like to thank everyone for attending. Thank our special guest and the moderator today. If you'd like to find out more about the Child Mind Institute, go to childmind.org. If you'd like to speak with anyone at RANE about how we might be able to help with some of the issues raised in today's call, please contact us for additional information. Thank you and have a great rest of your day.